important.
All right. So nice to see you, Ben. I've been away a little bit, and you've been, I think, recovering. It looks like your hair is growing back a little bit. How are you feeling?
I'm feeling pretty good, actually. Right now, I'm actually feeling really good. I don't know why, but it's been a weird 2, 3 weeks, however long it's been, of like some days where I feel really great, some days where I feel not so great. Today happens to be one of those days where I feel pretty damn good. And this is starting to heal. I mean, it's going to look pretty gruesome for a while, but it's starting to grow back nicely, I think. And the skin is, it's weird because like there's two halves of the skull that are like converging on that one spot. And it's almost like a mountain range is forming, a tiny little mountain range, and hopefully it'll flatten itself out. But from what I gather, it never will completely again. But who knows? And then there's this bump here as well that's funny. And then the thing on my chest hurts. That's the probably biggest complaint that I've had so far is this whole part of the procedure. The wires running from here. Like I can feel the wire. I can feel it all the way through. And there's days when like your neck is pretty sore, so you have to do all sorts of exercises. And it's just there's a constant tightness over your chest where the battery is. But it's not painful. It's just like a weird feeling. But yeah, it's actually been pretty cool to go through it to some degree. It's been annoying at times, especially those days when you're off a lot, or when actually there was one day in particular where I was pretty dyskinetic for the day, and that was really painful because when you're thriving about and you're shaking all around, you're constantly pulling on your muscles here as well. So all of those wires are being bent and stretched, and the battery's constantly being jerked around a little bit. So dyskinesia is actually something I felt like if I had very, very severe dyskinesia, this would be very difficult to go through. So I'm glad I don't, at least not at the moment. But I feel like that wasn't something that, well, whatever. Yeah, just something I think people need to be aware of as well is that if a patient has very severe dyskinesia, I would caution against, I wouldn't say caution against doing the surgery, but keep that in mind going forward.
So I think we spoke so we spoke before your surgery, and then I think I can't remember if it was in the hospital, and then we've texted a little bit, but I know that you've came home. So tell me about that sort of timeline. So you were in the hospital for how long, and then you came home, and then sort of what?
So I came in on a Tuesday morning. I left Friday at right around noon, just after noontime. That was now 2 weeks ago, I think. And since then, I've just been laying around the house recovering. The first couple of days were pretty tough when I had all the stitches in and it looked very gruesome. And the hardest part, well, one of the hardest parts is that you can't touch anything, or at least my surgeons here told me, don't touch anything. Don't put any creams on it. Don't put any ointments. Don't shower. Don't do anything to it. Just let it heal. And I guess that was the right advice, and it seems to be doing okay. But it's hard to live like that, where you're just kind of, and also you can't really move. Like every time I moved my right arm, I could feel the pectoral muscles stretching, and then the battery stretching, and then it felt like the cut on my chest was stretching. So that was rough. And then once you get the staples taken out, that day was really weird as well. When my sister-in-law is actually a doctor. She came and took the staples out herself.
Oh.
And but it was a really like strange sensation. I still can't feel the top. Like I can't feel that when I touch my head up here. This whole area from like here to the cut, really, I can't feel at all. So, but when she was taking the staples out, I could. It was like it wasn't pain. It was like
You're pulling.
I don't know what it was. It was like a weird tingling sensation. And then that whole day after, it felt like like something was seeping through the cut. And I kept checking the mirror, and there was nothing there. Yeah.
So, and then I know you're like the exercise king. So what's been the scene with your rehab and stuff? Like, have you been able to go back to exercising, or are you on some restrictions for a little while?
I'm on a lot of restrictions. So just a couple of days ago, I started doing some stuff on a stationary bike, but otherwise I can't really do anything. I definitely can't do anything upper body. I can feel like if I were to pick something up or do a push-up or something, I can feel that would not be good for the battery, or the wires in my neck as well. it's still a healing process. And as part of that healing process, you really just have to take it easy, do nothing. So I've been sitting around reading. Thankfully, soccer's been on. I've been watching a lot of soccer with my dad. And yeah, just hanging out, chilling, talking to friends, doing as much of nothing as I possibly can.
So are you kind of eagerly awaiting the programming, or do you feel like you want to press fast forward and like, be done with all the programming? Like, what's your sort of mental state? Are you like kind of zenned out? What's the scene?
So I'm able to, keep relatively calm and not get my anxiety up too high. But I am very much looking forward to that day. I'm very anxious to get that process started. But I'm also aware of the fact that I need to take it slowly, and that I need to be mindful of the fact that this is going to be a long process, and that even though they might have the ability to turn me on that first day, that might not be the best thing for me. You really do have to take it slow. I mean, I just remember going back in the surgery room in the day after, when I felt more or less back to normal. If I suddenly felt like that permanently from now on, yeah, I don't know what I would do, but I don't think it's healthy for most people, I think, to just suddenly switch back like that. I think it should be a gradual process.
Yeah.
So I think it's very wise on the part of my neurologist to say that we're going to be taking things very slowly.
Yeah. I mean, I think we usually try to just, let the body heal as it can, and the brain, because obviously there's been, things passing through there, and it can change, with swelling a little bit and then the healing from that. So we do want to wait. And then, I think the adjustments should be small, and, take it easy, and, just get used to things. And if we're making medication reductions, to do those very, very gradually, because a lot of these medicines have been things that you've been on sometimes for years and years. And the acute withdrawal, so taking that quickly away, or acute changes in programming, can really be tough for the brain to kind of handle. And so, we've seen patients who were programmed outside, and, people cut their medicines in half and like doubled their sort of stim overnight. And it was like, wait, what's going on? So, I mean, our philosophy is usually to, start low and go slow, and same with the sort of reduction, and just let the body kind of adjust, and then, get a sense here, get a sense there, and then slowly, because there's a few processes going on too, and you don't want to be confused at the end of the day. Was it because I stimulated the brain that I'm having this new issue, side effect, or is it because I took away a medication that I'm having a new issue or side effect? So it's always better, I think, to do kind of one thing at a time if you can, and, follow things and write things down if it's confusing in a diary, and kind of keep track of things, be in touch with your treatment team. And I would say, like, most of the time when we're counseling people, that we say, 6 months in, we should have some benefits and be on the way to, certainly, feeling better. But, anything before that would be, a bonus. So, we're sort of, and it's hard. It is hard. I'm sure the psychology from your side, and maybe you can explain a little bit more, is just, get it done. Now that you've decided to do it, you just want to go for it, and then have it, sort of optimized, literally as quickly as you can.
Yeah, looking back on the neuropsych evaluation that I did, I might be wrong, but I feel like it was more a test of patience than it was a test of the actual cognitive skills that they were testing me on. Because I remember a lot of weird things happened on that day that I went in there. But anyways, yeah, you really do have to be patient with this, because there's that temptation to just give me the remote, let me program it myself, let me figure this out, and then let me get on with my life.
Yeah. Yeah. Well, and they're going to be trying different things. And so just like a medication, if you try something and it fails, or you have a bad side effect acutely, you kind of cross that off the list, so it would not be good to go through multiple things so quickly, and you don't really get a sense of them, and then cross them off the list and feel like, you only have these parameters that are not causing, a problem for you or whatever. But, I think, luckily for you, Ben, you're in the best of hands, and you have like the world class. I mean, I'm not biased or anything. As a fellow Canadian who trained at U of T for med school, I think you happen to have the team that is, really making those strides, and your neurologist is very connected with you as a person, and the team knows you very well. So I think, they will take those extra steps and care that's needed to sort of make sure that you get, the best outcome possible. So, but it is kind of exciting, all of this. And I think, the good news is also that it's summer there, right? In Toronto. So the weather is good, and hopefully you can kind of take your mind off things a little bit with getting out in nature a bit and hanging out. And is the lockdown starting to get a little bit more relaxed, or what's the scene over there?
So I think they're about to relax it, and people now are almost on their second. Most of my friends, I think, are on their second dose of the vaccine. So yeah, people are starting to mingle again, but it's just not happening that quickly. Although the weather makes everything much better, makes sitting outside much better. Yeah, that's the nice part of it, of doing it at this time. If this was the middle of summer and it was cold and dreary and in the middle of a lockdown, it would be much.
Yeah. Yeah, if it was in the middle of a deep, dark Canadian winter, I think it would be quite bleak. So I'm glad the timing worked out, because it was, I think, a bit of a surprise, right, that it happened so quickly and you were able to align things so quickly. So
yeah, everything did kind of come together all at once, it seems.
So what's the plan for programming? You said maybe in a week or two?
Yeah, in 2 weeks it'll begin, and I'm also starting to realize and understand why it's so complicated and why it's going to take a while just to figure out the right settings. Because there's so many different parameters that can be tweaked. There's so many different things that machine can do, or these machines that are deep inside me now can do. Yeah, it's a complex process. I don't understand it myself yet. I'm looking forward to learning about it and getting to understand it firsthand. Yeah, the other weird thing is I kind of was expecting more would happen from having 2 metal rods shoved into my brain. I feel like I'm more or less the same person that I was before. I feel like not much has actually changed in the world. And I was expecting, I guess, something more drastic, because like you think of your brain as who you are and what you are, but suddenly having 2 metal rods shoved all the way through them doesn't really make a difference. Maybe the brain isn't as important as I thought it was to who and what we are.
Yeah, it's so complex, right? I mean, I guess those are sort of just acting as ways to stimulate you right now, and the stimulation's not on. So maybe once we start stimulating, you'll feel a bit different. But I mean, I'm always, continuously amazed by the resilience of the human body and spirit, honestly, and how much, you can go through, and sometimes trauma, sometimes, a big accident, or sometimes, a surgery. And you look at a person a week later and you're like, wow, this is what it says about you on paper, but like you look so much better, so that's always kind of exciting to me. And certainly because you're a young, otherwise super healthy, person, I think it makes it all the more easy for you to undergo something like this. So it would be quite different probably if it's somebody who isn't as young or isn't as healthy, or honestly doesn't have the team of amazing people that you have that are sort of around you. You also have, I remember you told me that you have great social support. Your parents have been like doting over you. You have, it sounds like, family that's also physicians who come to your house to remove your staples. So I think you're quite fortunate, in sort of an extra special way. You're already a special person, and then you have all this special stuff around you. So I think that bodes really well for you, Ben.
Yeah, it's definitely a plus to come from a family of doctors and engineers. But I have a lot of uncle engineers who have taken an interest in this as well.
You gotta watch those engineers though. Those guys can be like, you always know who the engineers are, who are your patients, because they come in with like this like Encyclopedia Britannica volume of all their symptoms. And you're like, oh, this is so okay, fascinating, like what are we gonna do? So that's why I always give people like that the motor diary, the paper motor diary, the old school, like figure out what times you took your pills, and let's like shade in this on off on with dyskinesia, sleep, whatever, so that you're, it's like, here's your day, this is all the information I want. I can't read the the sort of tome that you brought in, but
yeah, they've been teaching me all about like the electrical properties of the wires and thermal dynamics of the battery that's in me, and it's interesting and whatnot, but TMI right now.
Yeah, exactly. I don't know that you need to be focusing on things like that much. I think my sense would be, it's hard because I'm not you, right? And, we as doctors are obviously not, in your guys' shoes exactly, but we've seen, we get reports and we can kind of amalgamate those and try to give advice to people, as best we can. But I think that for now, just focus on, the summer, having, some beverages with your friends and family, maybe socially distance if the lockdown's still not, relaxed. And then once, they start programming, I would leave it in the trusted hands of Dr. Fasano, who I know is, really knows this stuff like the back of his hand. And then, I think as you're going through your changes, you can sort of introspect and make, some observations. But I think we don't want to have you spend all day, every day from this day forward, wondering, what that electricity is doing and the thermodynamics of, what those cells are, encountering. I think sometimes, as you and I have talked about, the mind and the body are very connected. So if you ruminate on these things, I think you can will yourself to not, do so well as well. So I think you have to kind of, have a dose of trust and, just focusing on other things and, putting your energy into, the things that you can control, right? Like, so the things you can control will be your exercise and, your social connecting and your diet and your sleep and, things like that.
Yeah.
And I think you and I have also spoken about the fact that we're making these videos, and I know you have had some people watch them. And I think you've had some great feedback, and I know I've had some great feedback as well. I think it's a great resource, but I think we want you to not have to just be the, feel like you're the documenter of this whole process minute by minute, but you can really sort of think about it a little bit more sort of holistically and give us reports once in a while. I don't want you to stress out too much about anything else.
Yeah, but this feeds my curiosity and my desire to just know things. So and it's impossible, I think, on some level, to shut that part of my brain off. I can't like stop wanting to know and stop asking questions and stop, because part of like those uncles that I talked to, the reason why they told me all that stuff is because I asked them. So it wasn't just them, regurgitating information to me. It was also me getting it out of them. And if there's anyone that can benefit from what I'm going through as well, then that's all the better. At the end of the day, I mean, while I'm hoping for the best outcomes for myself, if I can use this to do good in the world, all the better.
Absolutely. Well, happy to help you with that journey. And so how has the feedback been? Like, what's your sense so far, Ben?
How is what?
How has the feedback been from the first videos?
It's been overwhelmingly positive. I think the more interesting feedback I've seen is actually from the people who aren't connected to the Parkinson's community. So actually, the thing I got the most play on was the article I wrote called like, "The Agony and the Ecstasy of Deep Brain Stimulation Surgery." It was actually the most viral thing I've ever written so far. And it was just interesting looking at the comment boards of the message forums that it was relayed on, seeing like the outer world, the world that's not connected to neurology, what their take on it was. There was like kind of like two camps. One that was like, wow, I can't believe this is possible. I can't believe that medicine is able to do this. And another side that was, I can't believe you went through this. I can't believe, like, that sounds like the scariest thing in the world. I would never do something like that. Yeah, I just found it interesting just to see people's reactions to this process, because it is very alien. I think I mentioned this in a prior interview. It's a very alien thing to go through, especially for people who have no connection to this world. It sounds like something out of a sci-fi novel, I think, especially the one that I'm doing. But yeah, it's just, I've just been kind of interested just to see everyone's reactions and how kind of society at large reacts to this, to DBS.
Yeah. No, I think it's a fascinating thing. Yesterday, just as a side note, and you can do what you will with this part of this interview, but we had Janice Miyazaki on, who has been a mentor in the sort of palliative care world, and I think she's just a very embodied physician. And we were talking about the pandemic and also the human side of things. And Sarah Lidstone and I had also on the interview talked about crying in front of patients, or being honest, brutally honest, how brutally honest to be about what we know, what we don't know, how to show up you know, in patient encounters as, you know, people who have feelings as physicians and don't know all the answers and don't know exactly, you know, we're cheerleading, but we also, you know, want to, you know, give a dose of, you know, sort of, um, calm and collectedness, and you know, we're, you know, so it's like how do we sort of guide people in different settings. And she said two things that were kind of striking. One was that, you know, with the pandemic and seeing sort of doctors in their cars crying at the end of their day, or you know, breaking down in the hospital, or you know, literally, you know, sobbing, you know, publicly. The world saw a very humanized face of medicine, and I mean, not just doctors, but nurses and everyone, right? And then, you know, there's also this uncertainty that's been pervasive in this pandemic as well, where we don't have the answers and things change minute by minute. And one day we're told to wear a mask, don't wear a mask, you know, do this, do that, you know. It's ever changing, and the medical community is also in a sort of unclear state of what the future holds and how to guide people. And we're also learning, you know, from each other minute by minute, you know. And so I think we've seen maybe the medical community really in a face that's been historically very different, right? So we're supposed to have the answers, we're supposed to be stoic and, you know, sort of relatively emotionless and just present facts and, you know, be a little bit disconnected. So I think, you know, we were talking about how I was just saying how I feel like my practice has changed, and my, you know, honesty and how I present myself, I think will change. You know, maybe just part of this time frame, maybe it's part of my career, maybe it's, you know, some of the conversations that we've had, but it was sort of an interesting chat. So
Yeah, it's interesting to see the effect that it has on everyone, really. And yeah, as you mentioned, I mean, there's so many different components to this. There's so many different social aspects. There's so much psychosocial stuff that goes on. Yeah, it's interesting just to try to unpack it all and just ride this wave of exploration and discovery. And hopefully along the way, people learn something. Hopefully along the way, you know, some good happens in the world. And yeah, hopefully it makes life a little bit better for some people.
absolutely. Well, you look great. So we'll continue to chat about this, Ben, and wish you all the best. And yeah, have some good old Canadian fun out there. It's a beautiful time of year. I miss it, and I miss home for sure. So hoping to get back there soon. So good to see you, and we'll be in touch.
Good to see you too, Indu. Take care.